Partly cloudy with an high of 41 tonight. Drop down to a low of 38 tomorrow. A chance for some rain, some snow, and a high near 38 for tomorrow. In the studio, Ralph Eye Care Center, of course, the specialist there, and we've got Dr. Kayla in the studio. How are you?
Good.
If you want to adjust the mic,
pull down
there you
there
go.
we go.
Always
Bruce
have
is
it
kind of
wrong.
tall. Yeah.
Haven't seen you in a few weeks. Today we are talking about contact lens fitting.
Yeah, we have certain common questions that people call with, and we've been trying to address some of those things the last few weeks. And one is patients asking about a contact lens fitting, like why they need one, why there's a separate fee for one, what's different about it. And essentially, every 2 years, according to state law, we have to check the contact lenses to update the prescription. And, the contact lens, it's a, medical device. It sits on the front surface of the eye. And it can cause a whole lot of problems. So, Dr. Graham talked about a few things a few weeks ago about, corneal ulcers, blood vessels growing into the cornea, keratitis or just rough, red eyes, infections, irritation from the lenses not fitting correctly or not being cleaned correctly, that type of thing. And so, it's just important to have them assessed. And, usually the people who've worn them before, it's pretty simple. I mean, if they come in with the contact lenses, we can look at how they're fitting and check them right there. If you're a new patient, we need to measure the corneas and teach you how to put them in, take them out, clean them, double check them a couple weeks later. And the contact lens fittings include the follow-up visits. So when you pay that fee, you do get to come back, and multifocal lens fits and fits for astigmatism do take more follow-up time, and so you may be seeing your doctor 2-3 times after we fit those lenses. So it's mainly honestly a safeguard for patients. I've had people come in and they think their contacts are great and they've had them for a year or two, and I look at them and we'll take you out of those.
Really? They're that bad and they don't even realize it?
No, sometimes there's not really a whole lot of symptoms. Years ago, before, when people would wear the same pair of soft lenses for 5 years, they'd have blood vessels growing into their central visual axis. I mean, you could potentially blind yourself with them. Not so much anymore, but it can still happen. I mean, I've seen patients come in with things like that. So it's just, you wouldn't know sometimes if there's something wrong, and it's good to be set up with a good eye care practitioner that will take care of your contacts for you. And if you do have a problem, you can, come in and have them checked, or, you get your supply of boxes and you just don't really like them after a couple weeks, they're dry or something happens, we can take care of that. So,
if people want to get a hold of you guys, how do they do that then?
We're at ralpheyecare.com. You can make appointments there. We also have a Facebook page, Ralph Eye Care Specialists, and then 720-3553 is our phone number.
Easy as that. Ralph Eye Care Specialist, Dr. Kayla, thanks for stopping in today.
Thank you.
It's 7:43 here on the New Morning Show. It's New 92.